In this videos, I'm going to cover the 7 most important things that you need to do in nursing school that will help you study and pass your NCLEX. And in this video, we're going to cover how do you really define and understand that you truly do understand the medications. And that's called a method that I call AWHALES. So let's get into it. Okay, this is number 4 of 7 videos on this course where I'm covering all things that you need to do for mastering nursing school and the NCLEX. Okay, to recap, we talked about the 4 squares. Now, the 4 squares are a method that we do where we define the paper and we decide, when we're listening to lecture, like we said, always record your lecture and then listen to the content in relationship to your 4 squares. And the 4 squares are a method that where you define your paper into 4 different parts, where you start to write down the content as the teacher is talking. So if the teacher is talking about, hypothyroidism, and you will write down hypothyroidism. Okay. And then if you're like, I get a good concept of it, you write a plus next to it. If you don't know the content, you write a negative next to it. And then as the teacher is talking about meds like Synthroid or something like that, and you write a plus or a minus if you know it, if you don't know it. And that's what you try to do, is you try to pull these things together, and as we start to move through any diets, special diets, and and then at the end is like we basically will write down, this is lecture number 1, 2, 3, 4. And so you'll basically be pulling this list together, and then this will be your study content after the list. At the end of the class, you'll look at the concept and say, what was this concept we were covering today? And then try to tie it all together into one focused area. So the next thing we talked about is, what does that mean? That means the burn list. And the burn list is where we take all these 4 squares and we compile it into a target list, where if we're talking about Graves' disease and we didn't really know about Graves' disease, and we put a negative there, and that goes into a little book, like I said right here. And this little book is where it's small enough that can fit in your scrub pocket, and you're able to take this on the go with you. And you basically, what you want to do is you want to, if I study this content, I've got a good feeling for it, and how do I know that? And that brings the next thing where we talked about ACE sleeps, where Graves' disease is a content-based area. So then we're going to go into ACE sleeps. Graves' disease, is it acute or is it chronic? Well, it's a chronic condition and so on. How does it start? And then we start to move into that. What are some labs associated with it that I need to know? How does it affect eating? Is it high calorie? Is it low calorie? Is it high potassium? Is it low potassium? What's the assessment before? What do they look like? What do they look like? Exophthalmos, big eyes, all these types of things. What about after? After is generally teaching about it. What are some prescriptions with it? Is it hypothyroidism or hyperthyroidism? And so on. What are some problems with it? Patients with Graves' disease. Do they become hypothyroidism? Do they become hyper? And what do I do for that? And what's the 3 things that would stand out about Graves' disease? And that's what I want to do. And this ACE sleeps is a method that we do where we sit back, and when we're studying together as a group, we can say, okay, well, tell me what Graves' disease. Give me your ACE sleeps on Graves' disease. And then that person should be able to go through it. Now, if they can't go through it or they miss pieces, you should say, you know what, that's not really how it starts. Or, no, you missed this lab. And this is how you study together, is you take that content area and then you say, okay, well, ACE sleeps in. Right? We talked about that with like CHF. Well, first of all, CHF, you have to define right-sided versus left-sided. And an ACE sleeps on left-sided CHF is acute or chronic. Well, it's a chronic condition that could become acute. How does it start? And then we get into the MI and all these things. Well, some labs at BNP. And so you start to go into these things of, do you understand this content? Do you not? Okay, which brings up our next content, which is called, the purpose of this video is called AWHALES. Okay, now we're going to get into AWHALES. Now, AWHALES is a method that I use in order to really understand whether or not you know the medication. And it comes from 4 squares. Remember we talked about 4 squares where there's a med list. And that med list will be in the brain book. And that brain book will be your studying content of the unit or whatever unit you're in. And when we're looking at dissecting whether it's a plus or a minus, we said that before, if you're talking about a medication, and today we're going to use Coumadin. And Coumadin is a anticoagulant. And if we had a plus next to it, that meant that we knew that medication. But this time we're going to do it's a minus. Okay, so if there's a minus, that means I don't know the medication and I need to AWHALES it. And that's how we try to figure out whether or not we know the content or not. All right, so the first thing is Coumadin acute or chronic? All right, well, it's an interesting medication because a lot of patients that are on Coumadin can go home with it. But, would I call up the doctor at 3 o'clock in the morning about Coumadin? Well, there's two ways to think about this. The first question is, would you call up in the middle of the night to get an order for Coumadin? No. All right, so if I wouldn't do that, that makes it a chronic medication. But it has acute principles. And that principles means that would I call up a doctor because the patient's on Coumadin and they're bleeding? Yeah, so most chronic things have acute principles. And we talked about this previously with like a DVT. You could be diagnosed with a DVT, but the acute principle is when it evolves into a PE, or you can be diagnosed with hypertension. And though it's chronic, but it can become stroke. So if a patient is really hypertensive and suddenly starts exhibiting signs and symptoms of stroke, that makes it acute. So all chronic things can become acute. And knowing that factor is an important piece. So I always say decide whether or not you could call up the doctor in the middle of the night with this. Would you run down the hall, if a patient's on Coumadin? Only if it's an acute finding, and that acute finding would be bleeding. Okay. So how does it work? Well, this is rabbit hole stuff. Well, it's an anticoagulant. It stops the person from forming new clots, and it's generally given for a patient who has AFib, atrial fibrillation. And atrial fibrillation is when there's no P wave in here. And the reason is because the heart is really fibrillating. So it's really shake, 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 shake. Well, which means that that patient can throw a clot. And that goes back to Virchow's triad, which is the three things that cause a clot. So that's how it basically works. Now, there is some more factors as rabbit hole stuff like, the extrinsic factors, what factor is it, how it affects the clotting cascade. That's nuts to know. The basic idea is it stops clots from forming for patients who have risk factors for clots. So we monitor for bleeding. All right. All right, so the next thing is H. When do we hold it? Well, bleeding. Because the major issue is bleeding. So that's important to know. And there's certain labs associated with it that result in bleeding. Okay, what's the assessment before? Bleeding. Looking for signs and symptoms of bleeding. What about during? Bleeding, again. And then after, they get taught about bleeding. And I talked about this before with chronic things. Most chronic things require teaching. And the person that's taking it should have that understanding of this is what you're going to monitor for. You can monitor Hemocoat stools, you can monitor, epistaxis, previous surgeries, those type of things. Okay. What about labs? Well, very specific. Right? What labs are associated with this? Well, the PT-INR. That's priority labs for Coumadin. And we need to monitor that. We need to know what a normal PT is, 10 to 13, and we need to know normal INR, which is 1 to 2. And we need to know that concept and see my lecture on Coumadin where I really break it down. And then when do we need to report on it? Well, generally greater than 4, you report on it and you give vitamin K if that's the acute findings. Eating. Is eating involved with Coumadin? Well, most chronic things require some sort of diet or some regulation. And this is green leafy vegetables. Vegetables that are high in vitamin K. So I would need to know that. And then what's the standout 3? What are the 3 things that make me run down to the room? Bleeding is 1. An INR greater than 4 is another. And acute findings like bleeding. And so that's about AWHALES, and that's how you look at these medications. Now, all medications you should be able to run through the AWHALES. You should be able to just say, okay, it's acute or chronic, how does it work, when do you hold it, and this is what everybody in the class should know. And that's when you start to understand that, does everybody know the same thing here? Now, and that's an important piece, because when we get to the NCLEX and we talk about NCLEX questions, when you're doing your questions, you should be isolating these medications as you see them, and they should go into the brain book, and then we go on from there. Well, my name is Kevin, and this is Nursing Camp. See me in the next video where I talk about AWHALES. AWHALES is looking for the problem in a procedure, and AWHALES is looking for procedures. And so what we're looking at is general procedures of like spinal tap, and that's where I'll talk about that, and we'll see you next time. Nurse out.